Hi, my name's Kristen Adair. This is my second video on my journey to surgical correction for my Pectus Excavatum. So this is just a short little video to give the description of what Pectus Excavatum is. I wrote a short blog on it today, but that came directly from the Mayo Clinic, so this is my own words. And keep in mind, I'm not a professional or a doctor, so this is my own description in my own words, in my own interpretation. So basically, Pectus Excavatum is where your chest wall, your chest cavity, specifically your breastbone, bows inward or caves in. For a normal person, your chest wall and breastbone should bow outward slightly. So somebody with Pectus Excavatum has one that goes inwards, it sinks in, it indents. This is also called funnel chest or sunken chest. So the problem with that is when you have your chest wall caving in, it's going to be affecting your organs in the chest cavity. The very important organs such as your heart, your lungs, esophagus, all the blood vessels inside there as well. So just depending on the degree of your severity of your indentation, this can be pushing on things. So it can be moving your heart to one side of your chest where it's not supposed to be. It can be pushing on your heart, compressing your heart. It can be compressing and pushing on your lungs. So there's some things that it can be really affecting just depending on your severity. The main signs and symptoms of Pectus Excavatum are heart palpitations, rapid heart rate. Some people have a heart murmur, coughing or wheezing, chest pain, shortness of breath, exercise intolerance, fatigue. These are the main signs and symptoms. And of course, you'll see the indentation in your chest. This is said to be mainly in males, also in females, but it's more commonly in men or boys. And it's in 1 in about 300 births will have Pectus Excavatum. And they're not really sure where exactly it came from or how you get it. You usually can either have it two ways, hereditary or Marfan syndrome. Hereditary obviously meaning somebody in your family somewhere down the line had it, or Marfan syndrome is a genetic defect involving the cartilage. So there's an easy test you can do for the Marfan syndrome to find out whether or not you have that, and otherwise it's hereditary. So look down your family tree, and if you have it, then be careful that your children or your grandchildren, just to watch for that. There are a couple tests you can do to see what the Pectus Excavatum is doing to your organs, such as your heart and lungs. There's a CT scan, and that will actually visualize, an X-ray or a CT scan will visualize for you on a picture exactly how far you're caved in or indented and what exactly it's pushing on and how hard or how much it's pushing on these things. There is a Haller index, that's a measurement of your indentation. Anything above 3.5 is considered severe, and that comes from that CT scan usually. You can also do an echocardiogram that will look at the blood vessels in your heart, the valves, how it's functioning, how it's pumping. You can do pulmonary function studies, and that will see how your lungs are functioning, how much they're able to hold and push out. And then EKGs will show your heart rhythm, so if they're normal or not. Those are the main tests. There's usually 2 ways of fixing it. If you have severe Pectus Excavatum, it's surgical correction. If you don't have severe, sometimes they'll just watch it, or there's exercises, physical therapy you can do to try to expand your chest wall. But if you're severe, surgical correction is the only way to fix it. And there are 2 different procedures. One is called the ravage, where they cut you open down the front and pretty much have complete visualization of the breastbone to fix that. And then there's the Nuss procedure, which is a minimally invasive, and they go in through your side with bars. So that's it for now, and that's just my basic description of Pectus Excavatum. And I'm hoping that my next video we can start to get into my very first step of what I did when I started to have all these problems and how I am finding out what's going on with me. So stay tuned, and I will talk to you later.